If you're suffering from a frozen shoulder, if you have pain or loss of range of motion in usually one side and not the other, and you're worried, am I ever going to be pain-free? Or am I ever going to get that range of motion back? This video is for you. Hey, my name's Lucas. I'm a yoga teacher and a teacher trainer. At least once a week, someone comes into class and they attempt to do downward facing dog and they realize, whoa, what happened to one of my shoulders? I'm suddenly either having pain or loss of range, and they're worried that maybe it's permanent. Adhesive capsulitis, or a frozen shoulder, is a very peculiar injury in that it often comes out of nowhere, and the healing journey can be really long and unfortunately a little bit frustrating. In this video, we'll talk about how to test yourself for frozen shoulder. Number two, we'll talk about the anatomy and what exactly might be going on. Lastly, I'll share with you a very simple at-home routine that you can do in bed, either right when you wake up or right before bed, as corrective exercises to help you heal. Quick disclaimer here, I'm a yoga teacher, not a medical doctor. In all cases, I would very much encourage you to go get an x-ray done, go meet with a doctor, make sure you rule out things like neurological conditions, rule out things like rotator cuff injuries. Sometimes the symptoms can be very similar. It's easy to get confused. Frozen shoulder is a strange one. You want to make sure you know what you're dealing with. Nothing we'll do here is dangerous in any way for other injuries, but clarity is really important in your healing journey. Let's do a quick test to see if you have some common symptoms of frozen shoulder. First one is if you extend your arms here with a 90-degree bend, and then you attempt to laterally rotate at the shoulder joint. Oftentimes, if you have frozen shoulder, the frozen one will go very, very low angle, maybe 15, 20, maximum 30 degrees. And if you compare one to the other, it's usually about half the rotation. The next range of motion we would test is what I showed you before. It's called shoulder flexion. And often you'll notice you might get stuck at 90 degrees or maybe stuck at a little bit more, but the frozen shoulder will either have pain or it'll have limited range of motion, or both potentially. The last one we'll test, you can do other tests, but usually with these three it's enough, is opening your arms to the side. This is called abduction, like we're getting abducted. Usually you'll get stuck at halfway, meaning 90 degrees, and you might even find yourself doing things to compensate, like hinging at the hips or elevating your scapula. Very common sign. Here's what's weird about frozen shoulder. It goes in three phases. The first phase is called the freezing phase, but I think it's better to think of it as the pain phase. And this is where you go, ouch, and you feel that almost sharp shooting, wincing pain. And this phase tends to be short-lived, and it's followed by the frozen phase, where maybe the pain is not there, but suddenly you still feel that blockage. It almost feels like, was I ever able to open my arm to the side? And that phase can last a really long time. And phase three, this is what we'll focus on today, is the defreezing or the thawing phase, where we hopefully get that frozen shoulder unstuck. Here's the challenge. 4 months healing time, very common. 12 months, 13 months, really about the average. And some people 3 years plus. So we can be talking about loss of range of motion for a very long time. And to make things even more complex, unlike knee injuries or hip injuries or spine injuries, where it's very difficult to get through the day without utilizing those joints, at least in a decent range of motion. It's common, even more common than not, to get through the day not really using your shoulders much at all. In fact, many people who come to my yoga class, when they extend their arms above their head in full shoulder flexion, that might be the first time they've done that range of motion in years, which means if you have a limitation and you continue to ignore those ranges of motion, those things can be permanent. So what exactly is going on? Well, if we look at the anatomy of our shoulder here, this is an anterior view. I have pulled away our subscapularis, which is one of your 4 rotator cuff muscles, so that you can see the humerus. This is your arm bone, and this is your glenoid fossa, that concavity on your scapula. One thing that's cool about the shoulder joint is that it's a ball and socket joint, but it's very shallow. So unlike your hip, which has really good range of motion, your shoulder has crazy range of motion. The most range of motion of any joint in your body. We can circumduct, we can abduct, we can adduct, we can rotate, we can flex, extend, we can even hyperextend. Your shoulders can do all kinds of things. That's good. Really prone to injuries because of that crazy range of motion. This is potentially bad. When we think about frozen shoulder, we often think about rotator cuff arthritis, and while those things can go hand in hand, usually frozen shoulder is unique, and it's referring to the joint capsule itself. You can see the humerus, you can see the glenoid fossa. What you don't see here, and you don't see in many illustrations, is that synovial joint capsule. Think of this like fleshy duct tape wrapped around. All our synovial joints have a joint capsule, and it's a fluid-filled sac, a fibrous sac that holds everything together and keeps everything lubricated. When that sac becomes stiff and inflamed, that's when we get this particular condition of frozen shoulder. Okay, so why does it happen? Why does that sac get stiffened? We don't really know. Seems to be related to metabolic disorders like diabetes and high triglycerides. Even things like cholesterol are correlated with frozen shoulder. Thyroid problems, for example. It tends to happen to women more than men, although men get it plenty. The age group is very curious. It tends to be 40s, 50s, and early 60s. And it tends to be a disease of aging, and it is very manageable. But again, we're talking about a relatively long healing path. Things to think about with your frozen shoulder. You really need to articulate and move your shoulder. You don't want to avoid it. Just letting it be is not a good strategy. We want to do daily exercises. What I'll share with you now is a routine that you can do in bed at home, either first thing in the morning or right before bed. The most important thing is daily practice. When you're practicing, you will need 2 cans. I have cans of beans. You can use soup cans. Leave them next to your bed. You'll need a belt. Again, leave it next to your bed, and you'll need about 7 minutes in total. So it's not so long, but very important that you do this on a daily basis. A couple of rules about corrective exercises. Number 1, you go right up to the pain or the limitation, and you take 1 step back. That's where we work from. Rule number 2 is perceived exertion or intensity, 4 out of 10 maximum, no further. You really have to take little baby steps. And rule number 3 is it needs to get better to get better. If you do corrective exercises and you feel more pain, more inflammation, more limitation, no good. It needs to either stay the same or get better, or you're doing things incorrectly. Before we jump into this, I know many of you are thinking, that sounds like a lot of work, 4 months, 12 months. Can't I just go get a cortisone shot? Can't I just go get arthroscopic surgery? The answer is you certainly could, but even your doctor will in most cases recommend self-care first. The outcomes of those medical interventions are not so great. So let's get into some corrective exercises. Let me show you what we'll do. The first exercise we'll work on is called windshield wiper and doors. This is working on lateral rotation to the outside, medial rotation to the inside. Grab your soup cans, bend your elbows at 90 degrees, place your elbows on tops of blocks or pillows at your sides. Attempt to keep your elbows and your shoulders as still as possible and simply rotate. Remember, we go right up to the place of pain and then we take 1 step back. We never push into pain, and in terms of intensity, 4 out of 10 perceived exertion, that would be maximum. Even less is just fine. To begin, let's inhale and windshield wipe our arms to the right. Exhale. Let's inhale, windshield wipe to the left. And exhale. Let's inhale, windshield wipe to the right. And exhale. Let's inhale, windshield wipe to the left. And exhale. Let's inhale, windshield wipe to the right. And exhale. Let's inhale, windshield wipe to the left. And exhale. Inhale, windshield wipe to the right. Exhale. Inhale to the left. Exhale. Inhale to the right. Exhale. Inhale to the left. Exhale. Good. That's windshield wipers. Put your cans down. Shake your arms out gently. Grab your cans. Place your elbows in the same position. This time we'll open and close the doors. Start with your elbows bent at 90 degrees, just like before. And let's open the doors, both
shoulders rotating to the outside just before you feel a block, discomfort, or a sensation. And let's hold right here with open doors. And then slowly close the doors. Wing your elbows out to the side. Place the cans right at your sternum. And let's hold here with closed doors. Good. And slowly place your soup cans down. Shake out your arms gently. And our next pose will extend our arms above our head. This is called shoulder flexion. I'd like you to be extra careful here, but grab a belt, a strap, a robe belt, anything you might have in your bedroom will work just fine. Clasp the belt between your hands. Lying on your back, you might need pillows or your headboard for support. Remember, 4 out of 10 maximum perceived exertion, and always go right up to the place of pain, discomfort, blockage, and then take one step back. That's where we work from. Find a place where you need to stop. Pause there. We'll pulse here with 5 breaths, and then we'll hold for 3 breaths. Lower your arms down by your thighs, still holding on the strap. Good. Now inhale your arms up to that point we just discovered. Slowly exhale your arms back down. Inhale back up to your stop point. And exhale back down. Inhale up to your stop point. And exhale back down. Inhale up to your stop point. Exhale back down. Inhale up to your stop point. Exhale back down. This time we'll hold at the top. So inhale up just to your stop point. And now stay right here and we'll breathe together. Good. Slowly lower your arms, shake out your arms, grab the backs of your knees, and make your way up to a seated position. Use that belt or that strap and grab the belt or the strap back behind you. Now, I know this can be really intense. Don't go to a very intense place. Even if your hands don't even go past your waist, hold on to the strap and you find a place. Find where that tension is, find where that block is, and then take -1 step from that discomfort or that block, and that's where I want you to stay. So you find your place, and let's hold here. This is called extension, or for some of you, if your arms are back behind you, hyperextension. Let's breathe here together. Good. Now slowly release your strap from a seated position. Again, grab your soup cans. This time we'll extend our arms out to the side. This is called abduction, abduction, like the aliens are abducting your arms. If possible, keep your arms all the way straight. Many of you will find blockage very quickly here or discomfort. Remember, you find that pain or that blockage and you go -1 step right before that place. We'll do 5 breaths dynamic, moving with the breath, and then we'll hold for 3 at the top. Let's inhale, extend your arms. And exhale with control. Inhale, extend your arms. Exhale with control. Inhale, slowly moving with control. And exhale, slowly back down. 2 more times. Inhale. Exhale. 1 more time. Inhale. And exhale. Good. Now go to your place, the place right before you feel discomfort or blockage, and let's hold there. And slowly lower your arms down. Release the cans and shake out your arms.
I hope you found that video helpful. One of the things that's important to remember about frozen shoulder is just because pain is going away, that doesn't necessarily mean you're overcoming the condition. Remember, it's very typical for pain to go down pretty quickly. You need to be regaining that range of motion that you've lost. Second thing to remember is focus on months, not days, so be patient and make sure to make a little bit of investment of time every day in these corrective exercises. If you'd like more science-based yoga videos, hit subscribe down below. If you have experience with frozen shoulder, if you've tried something that we didn't mention here, if you have a different input, I'd love to hear from you in the comment section down below. My teaching calendar is at YOGABODY.com, and I have a PDF down below with the exercises that we've covered here as well. Thanks so much for joining us, and I hope to see you in the next video.